Since the advent of COVID-19, pharmacists have served around the world, screening patients, referring them for treatment, and also managing their course of therapy. Around the world, there have been 12.4 million confirmed cases, with 6.83 million people recovered. In Nigeria alone, there have been 31,000 plus people confirmed positive and 709 deaths. Pharmacists and other healthcare workers, due to the nature of their work, interact with patients with highest risk and patients who may likely be ill, hence facing the highest risk in their population. Pharmacists are also concentrated in areas with high population density, hence they are in the midst of the epicenter when community transmission begins. With the high health workforce deficit in Nigeria, coupled with the distribution imbalances in favor of urban areas, it is not hard to imagine the damage to public health COVID-19 will cause if it impacts a small subsection of our pharmacy workforce. These risks are compounded by population hygiene, health-seeking behavior, and funding. The PSN, FIP, and WHO have released several practice advisories since the beginning of COVID-19. It is time to update these as new evidence begins to emerge, showing that peculiarities of workspaces may challenge known norms of infection prevention and control. Pharmacists practice in spaces with different specifications, from open clinical environments to contained aseptic areas, from free access premises to variable access units and offices. This webinar will address the risks inherent, more so what should happen when there is an exposure in the workplace, how should the risk be communicated to prevent a community panic. Our keynote is the distinguished infectious diseases consultant, Professor Adebola Olayinka. Our distinguished host is the PSN President, Maazị Sam Ohuabuwan, FPSN OFR. Our distinguished panelists include the Director of Food and Drugs, Federal Ministry of Health, Pharmacist Mashood Uluku Lawal, FPSN. Also included the National Chairman of ACPN, Pharmacist Sam Adekola, FPSN, the National Chairman of AHAPIN, Dr. Kingsley Amibo, FPSN, the PSN Lagos Chairman, Pharmacist Iyola Gbolagade, FPSN, the PSN FCT Chairman, Pharmacist Jelili Kilani, FPSN, the DPS, Lagos State Ministry of Health, Dr. Moyosori Adejumo, FPSN, and FCT DPS HHSS, Pharmacist Boniface Iko. Don't miss this Zoom webinar. It is nothing like you have ever seen before. Join us. As men of honor, we join hands together.